I've worked as a home care physical therapist for many years. It's the patients, families, nurses, doctors, caregivers who have taught me how to do my job and given me that extra perspective. But not just to do my job as a job for a paycheck, but for something more. You know, my job is a heartfelt passion mission to go that extra step, speak for those who can't speak for themselves, and really, you know, figure it out when others have quit trying. I have a few stories to tell you, some patient stories to share with you that kind of show you what I mean. I worked with a young woman who was an amputee, and I went in for home health care to help her get a prosthesis and find one that will fit her right, and she can walk in it and have good balance and, you know, resume her life. And I thought I knew what she felt, what she was going through. But I only to a certain point, because I've never had a limb amputated. I've never lost my leg or my arm through, you know, from a surgery. Never had to wear a prosthesis, never walked different, never looked different because I had an artificial limb. You know, I could only relate to her to a certain point, to a certain extreme. So what I felt was, you know, the next step was to find her other people that she could relate to, who had had amputations, who had gone through what she had gone through. And that's exactly what I did. So she and I started the first amputee support group in Las Vegas when I first became a therapist. Was that my job? No. But it was part of my care for her to help her extend and to really be able to relate and continue to heal at a higher level. So another gentleman I work with was a paraplegic. Now, quadriplegic is when all 4 limbs are paralyzed. This gentleman had 2 limbs. His legs were paralyzed. No feeling or movement in his legs. So I was sent in there to do some home health care. And I thought, what am I going to do for this man? He's been a paraplegic for a long time. He knows how to transfer. He basically lives in his wheelchair. So I started seeing him, and you know, we worked on transfers in and out of his wheelchair, chair to bed, in and out of his car, those kind of things. And then a few weeks in, he shared with me, he said, I have been praying for God to send me a physical therapist that will help me walk. I mean, I was touched, but the man's a paraplegic. He doesn't have any feeling or movement from the waist down. You know, I'm not sure, you know, what I could do for him. But he felt I was the one. He felt God had sent me to help him and work with him. And I worked with this man for over 1.5 years, which is a long time in home health care. So we worked on the transfers, we worked on balance, we worked on, like, when he would move from his wheelchair to the bed, we worked on him putting weight through his legs, because normally he would just scoot his bottom over and not even put anything, you know, through his legs. So we worked on that. And then out in his garage, you know, home care, I go to their homes. So out in his carport area, he had a half wall. And so we put knee pads on him, and because his arms, he was really strong in his upper body, and he would pull himself up to standing. There was a post right there from the half wall up, and he would pull himself up into standing. And initially I could hold him up there, but just for, you know, a couple minutes, because he was big, and, you know, I just couldn't maintain, you know, that position. So he was in standing, and so we put a strap around his bottom. So his knees were braced up against the wall, and there's a strap around his bottom. So he's pulled up into the standing position, and he could sit there. We started for a few minutes, and then he could tolerate longer and longer time, and eventually he was able to stand 30, 40 minutes to an hour with weight bearing through his legs, which was amazing, you know, incredible, especially with home care where you don't have the equipment and a lot of things they have in outpatient therapy. So the next step was, he's like, okay, you know, I want to walk. What can we do next? And so he still, I mean, he didn't have any, you know, feeling or movement in his legs. So I contacted a doctor and got an order to get him some braces. So he was fit with braces, got them created for him. We went and picked him up, brought him to his house, and put him on. So when he pulled himself up into standing, from his wheelchair, standing at his walker, his leg braces would lock into extension or lock straight, so he could stand. So he would stand just holding his walker, and then we would start, like, I would pull one leg forward and the left leg forward, and then he would move the walker, and then I would pull the right leg forward and then the left leg forward and then the walker. And so he was able to take a few steps. So it progressed to him being able to throw his hip forward, which allowed him to advance the leg himself, his right leg, and then his left leg. And so over time, he would push the walker forward, and then he would move his legs in the braces, and he was walking. You know, did he have movement in his legs? Did we find a way miraculously for his legs to recover? No, but he was able to walk with the braces and a walker. He walked 50 feet across his driveway. Amazing. And that's what he wanted to do. And so after that, and then now he wants to write a book, and he wants to be a speaker, wants to be a motivational speaker and tell people his story. Incredible, incredible, amazing. So that was a great story. I'll never forget him, and he says he'll never forget me. So I think we're bonded in our stories for life. And it isn't always difficult or complex, the answer. You know, I had a gentleman who had severe hip pain on one side, but so bad that he couldn't walk. He was in a wheelchair. For 6 to 8 months, he hadn't walked, and he was in a wheelchair. So every time he would try to go from his chair to his bed, I mean, he'd have severe pain through that hip. So on my first visit, I did an evaluation with him, and I noticed that one leg, his painful hip side leg, was the leg that was shorter than the other leg. So I'm like, So I had this little fleeting thought as I was finishing up with him. I thought, let me try this. So I had him put a shoe on the shorter leg, which was his painful side, and I had him take his shoe off of the other leg, his opposite leg. And then I said, just stand up. So he stood up, and he had this big grin across his face. And I'm like, what's the matter? What's going on? He said, it doesn't hurt. So I was like, well, that's pretty cool. He said, can I take a few steps? And I said, well, with your walker, you know, take a couple steps, be careful and go slow. And so he took a couple steps. Well, after we walked to his bedroom and back, you know, I almost couldn't hold him back, almost couldn't stop him. He was so ecstatic. He was grinning the whole way. He got back and he said, it barely hurts at all. So that was just tremendous. And that was a very simple fix for this gentleman. You know, did I have the magic touch? No. Was I curious as to why this man couldn't walk? You know, he had some decent strength, but why couldn't he walk? The pain was in his hip. Why couldn't he, you know, walk? So my detective popped up, you know, and I had to figure it out. So that was a very simple fix. And it wasn't a permanent fix, but it was a simple fix to show that he needed some balance. He needed his legs to be the same length for that hip pain to be calmed down. So that was very cool. So the next time I come back to see this man after the weekend, he is walking all over his house. He's walked to his garage, and he's standing at his stove cooking, which he hadn't done in over 8 months. He was thrilled. So home health care, I mean, I just felt that, you know, that we were really meant to be together, and for some reason I was able to figure that out. So was able to create some balance for him and to help him figure that out. And, you know, I just believe there's always a way to find more information, to have less pain, to make things better, to find a better answer, or to change your life. You know, I just figured it out. And why do I have that passion? Why do I believe that? Well, I don't totally know the answer. A little bit of it is part of that is my dad. When I was growing up, he taught me to, have respect for others, and especially the elderly. He's like, you'll be old someday, you know, and he would always respect others that were less fortunate with him, but always his elders, his parents, very respectful. So he helped me with that part. I have a heart that's just passionate to help others. I'm not sure what that comes from. You know, I want to speak for others who can't speak up for themselves. When someone says, no, you can't, no way, you'll never, that just sets it off for me. That makes my detective kick in and say, let's look at this. I'm sure we can find a better way. I'm sure we can do something with all that. And, you know, that's just how I am personally and professionally in my life. You know, there's always a way to figure something out, to make it better, to find a different answer. You know, if you don't know the answer, then you're probably not thinking outside the box enough. We haven't thought of unusual ways to do things. You know, the typical the typical way is not always the answer. So, so anyway, these patient stories just kind of help you a little bit to see how I work. I like to continually grow and learn for myself personally, and I like to just keep shining that light and making things better for others, and kind of, you know, as I go. So that's my way.